Good afternoon and welcome to Arkansas Children's. We are talking live with Laura Phillips today, and today we're talking about COVID-19 testing. And if your child has to have surgery at Arkansas Children's, they have to get tested 48 hours prior to having surgery. And we know that can be a little scary for families, especially children. The test goes up your nose. Laura's actually going to show us more of the test. And so we want to prepare families so they can help their children prepare for the test. So Laura, and Laura's with Child Life, which is a perfect fit for why you're here to talk about how to prepare your child. If you could tell us a little bit about what Child Life does at the hospital and how you help children.
Okay. Well, the idea behind having Child Life in the hospital is to assist with coping for both patients and families. We do that through a variety of ways. Our background is in child development, so we can provide education and play at a developmentally appropriate level, and we do that all over the hospital. I work in the ambulatory surgery center, so I help prepare children depending upon their age. We give them information that can let them know what they're going to hear and what they're going to see and what they're going to feel when they come into the ambulatory surgery center, and go back for their procedure or their surgery.
Excellent. And kind of backing up to really the why of getting a test. Why is it important that every patient is getting a test, a COVID-19 test?
Well, one of our core values here at ACH is safety, and we want to make sure that patients, families, and staff are safe, and the test helps us to prevent the spread of the virus.
And right now, patients are getting this test through a drive-through. It's a little different because we are wanting to keep our patient population safe. So we're doing the test sometimes in the car. Can you tell us more about the testing procedure?
Okay. So you and your family will drive up to the testing center. A nurse will meet you at your car. It is outside, and the nurse will be wearing her protective clothing, her PPE or his, and they will have on a gown and a mask, and they'll also have eye protection and gloves. So if your child is young enough to still be in a car seat, the child remains in the car seat, and the nurse can reach through either through an open window or, if necessary, actually get into the car to do the test. And for the younger children, they will also stay in the car, and it will be the same procedure where the nurse can either reach through the window or, if necessary, get inside the car.
Okay, so a little different than normal, but we are trying to keep everybody safe. So if you were describing the test to a child or families who are watching, how would you tell them to describe the test?
Okay. Well, the test involves using a swab that's similar to a Q-tip, but it's a little bit longer. This is not the exact swab they would use, but it is similar. And that swab has to be placed inside the nose and then swirled around a little bit. Then they take the swab out of the nose and place it in a container to send to the lab. And as far as preparing your child for that test, depending upon their age, for the younger children, you can let them know that their job will be to stay still, and you can say stay still like a statue. That's a phrase we often use. The test is brief. It won't take very long at all, just a few minutes. And it can also be helpful to provide a treat for the child so that after the test is done, it doesn't need to be anything big. It could be something like their favorite food or playing with a favorite toy or going somewhere they like to go so that they have that to look forward to. And it's also important in terms of explaining the test and talking about it. It's not necessarily a test any of us would look forward to, but it is important as their caregiver to be positive and to be calm in your explanation of it, because particularly young children will often pick up on our anxiety as adults, so that if we're describing it, with some kind of nervousness and anxiousness, then they can pick up on that. You also want to prepare younger children closer to the day that you will be coming, and then give them reminders. And you can also just talk about how that you're going to go and do the test, and then you'll be able to do something fun afterwards.
I like that idea. I have a 4-year-old, so I would definitely plan a trip to the park or something fun afterwards. So now, after the test has been given, the patient will return about 2 days later. So how can parents get them back in the car to come back to the hospital where they had a test that maybe they didn't enjoy too much?
Yes, that certainly can happen. So one of the things you can do, particularly for younger children who are very concrete thinkers, you know, they may see the hospital when they get here and say, oh, I don't want to go there. So you can talk about it ahead of time that you're actually going to a different part of the hospital. The area where the testing is done is different from the area of our campus where they'll be coming for their surgery or their procedure. So you can let them know that, well, we're not going back to that area. We're actually going to a different part of the hospital.
I like that idea. And we are actually going to do a similar demonstration. We have our friend Jacob here with us. And also so parents, so we're going to let Jacob get settled in the chair. Also so parents are prepared. We are shifting our testing practice to make it less invasive. It's not going as far up the nose as the previous tests have, and this is something that actually recently just changed. So for future visits, please know that it's not going to be as invasive, which is good news for everybody. So if you could kind of take us through the testing procedure on Jacob, what would you say to him during the process?
Okay. One thing I did not mention before, if your child has a comfort item like a stuffed animal or a blanket or something like that, it's a great idea to bring that with you because that can be helpful for them in terms of providing comfort during the procedure. So Jacob here, Jacob, your job is going to be to stay still during the procedure, okay? And the reason you need to stay still is so that the nurse can do the test quickly, and then you can be on your way and go do something fun, okay? Okay, do you think you can do that?
Yes.
Okay. And sometimes if you feel a little bit nervous, sometimes it helps to take some deep breaths. And I don't know if you still do this at birthday parties, but you know, blowing out all those candles on the birthday cake, it takes a lot of breath, doesn't it? So sometimes when you feel anxious, like maybe right before the test, you can just be, and that just kind of relaxes you and just relaxes your body. And you can also think about something that you like doing. Maybe think about, oh, afterwards we're gonna go get ice cream. I think I'm gonna get strawberry or whatever your favorite flavor is. So during the test, if you can just stay still, that's all you have to do, okay? All righty. Is there anything that you would think might be helpful in terms of helping you stay still? Deep breaths, awesome, okay. All right, so the swab is going to go up the nose, okay, and we're of course not doing that today, but basically you want your child to be still during that process. If they're a younger child, hold them in what we call a comfort hold. You can hold them in your lap. Jacob's too old for that, of course, and he's gonna be able to stay perfectly still. But for the younger kids, you can hold them in what we call a bear hug. You can put your leg over their legs, and that just makes them feel more like they're being held rather than that it's more of a comforting kind of hold. All right, Jacob, great job.
Okay, thank you, Jacob, and thank you, Laura. If you have any questions about the COVID-19 testing, if your child is scheduled for surgery and they're going to have the test, and you have any concerns, please leave them in the comments below and we'll make sure to get them answered. But please know, like I said, we are shifting our practice to make it less invasive, so it's not going all the way up the nose, which is good news for you and your family. So continue to stay safe, wear masks, wash your hands, and stay healthy. We'll see you next time.